Hi everyone, Dr. V. Shaw, Clinical Director at PAC Health here with our weekly COVID-19 update. I hope everyone is doing well and staying safe and healthy during this time. A couple quick updates regarding COVID-19. Depending upon where you are, you may have noticed that the social isolation and stay-at-home orders are starting to ease. If you are in an area where they are easing some of these restrictions, we encourage you to stay safe and follow the CDC recommendations regarding maintaining a 6-foot social distancing space and wearing a mask when you're in public. If you need any information on how to make a mask from at home, check out our website. We have a great infographic. We also have a great new blog post this week about how to take care of a loved one who may have COVID-19 or who has been diagnosed with COVID-19. Some of the tips that we recommend are making sure that they have their own space in the house and making sure that you use gloves and a mask whenever you're going to be around them or cleaning up after them. So if you have any questions, make sure you reach out to your health advisor and check out that blog post. We also have some information about what it would look like if one of your loved ones ends up in the hospital and some tips to make sure that you get the information you need to make sure that they stay safe and that they have an advocate there. So this week, we're really lucky to have Dr. Meg Mullen here with us. Dr. Mullen is a good friend of mine and a palliative care doctor in Washington. So thanks for being with us, Dr. Mullen.
Oh, it's my pleasure. It's nice to see you.
Good to see you too. So Dr. Mullen, this is an opportunity for us to talk to our members a little bit about palliative care, which is not something that everybody has a lot of knowledge about. So could you give us a little background on what palliative care is and what you do in the hospitals?
Sure. So palliative medicine is a subspecialty of medicine that is concerned with patients and families who are facing very serious illness. As a person is moving through a serious illness and things get more complex, it gets harder and harder to manage all the information coming at you and to make decisions. So I work within an interdisciplinary team of doctors, nurses, nurse practitioners, chaplains, social workers, to be an extra layer of support for patients and families as they're going through their journey. Part of what I do is pain and symptom management, and here in the hospital, I'm a consultant. But a big part of what I do is meeting with patients and families and talking through all of the medical information that they're getting, trying to figure out who they are as a family unit and as people, and making sure the medical plan matches what's really important to them.
So Dr. Mullen and I have worked a lot together in pre-COVID times, but things have definitely changed a lot with COVID. So Dr. Mullen, what are you seeing are the differences between palliative care before and how is palliative care involved with COVID patients right now?
Yeah, we are definitely living through very different times. The virus has affected all aspects of our life, not just people who have been infected by this virus and are seriously ill in the hospital, but our entire society. And a big part of that we're seeing in the hospital is that families aren't allowed to visit their sick family members, even if they don't have the virus, if they're here for other kinds of more normal things that people get hospitalized for. And so my team's role has really been to facilitate communication as much as possible and to try to facilitate people in decision-making when they can't be really present at the bedside. The other part of this is that people aren't seeking care. And so when we are seeing people coming out of their houses because they are sick, they tend to be a lot sicker. And so prognostication and being able to help people understand where they are in their illness has become a much more relevant topic as well.
So Dr. Mullen, when you talk about decision making, we talk about really important decisions that come up. And so what I was hoping is you could really give us an idea of what kind of decisions are you talking about, and when people have to make these decisions, what are some of the ways that we have to address them? Like, how do we know about them? How do people give us that information?
Sure. So we make decisions all the time about care plans, but as a person's illness advances and they become more seriously ill, the right path forward becomes much more personal. So when a person's acutely ill in the hospital, we may need to talk about what are our goals? What are we trying to accomplish? Is it something that's really practical? Like, are we really honoring somebody's wishes for quality of life? Are we trying to medically prolong their life at all costs because that's what they value? Those kinds of really values-based decisions come up in the acute setting. But even more importantly, and hopefully more frequently, a person's in the hospital, they're getting medical treatment, they're getting better, and they're going to go home. So at some point, there comes a time when we have to realize that they're going to get sick again, and having conversations about what they might want when they're not acutely sick, and doing advanced care planning and advanced directives helps head off those difficult conversations when someone is not able to really speak for themselves.
So you just mentioned advanced directives. Can you tell us a little bit more about advanced directives? I know they come by a lot of different names, and so can you tell us some of the common ways that they're referred to and how they work within the hospital setting?
Sure. An advanced directive is a document that a patient and family have prepared ahead of time that addresses some of the primary decisions that might need to be made if they're facing a life-limiting illness. So some of the conversations that come up are, how much care would a person accept? Would they be willing to undergo mechanical ventilation in an intensive care unit? At what point would their balance shift over to really focusing on being comfortable? How do they like to get information? And who should be making decisions for them if they can't make decisions for themselves? There are a variety of different names that these documents go by. You can have an advanced directive that sometimes a hospital system will supply that walks you through how to document these choices. There's things called a living will, which often gets completed with a lawyer that tries to outline these details in more exacting language. And there's something called physician's orders for life-sustaining treatment. Each state is a little bit different, but if a person has decided that they don't want to be transported to the hospital, that they wouldn't want to be on a mechanical ventilation, or have other strong preferences about what kinds of treatments they would or wouldn't accept, these are physician's orders that they can take home with them to represent their desires if they can't speak for themselves.
And I think just to that point, I think the PULSE, the physician order for life-sustaining treatment, is called different things in different states, but those are legally binding. Is that correct?
What's legally binding is your surrogate decision maker. So the person who is either your legal next of kin or the person that you have legally designated to make decisions for you is ultimately the person who makes those choices. But they use advanced directives as a way to guide the conversation so that they are speaking with your voice instead of trying to make independent decisions about what they think is right or wrong.
Perfect. So you mentioned that a lot of this is about helping your loved ones help you make decisions for people, right? And so I think during this time, during COVID-19, what we've realized is that a lot of people are talking about their health. How would you advise one of our members to, if they had a loved one that they wanted to really get into this conversation about, how would you recommend them starting that conversation? And what kind of questions that are really important that get addressed during this time?
A good place to start would be to just do a little Googling. There's some great resources online. So one organization is the Center to Advance Palliative Care, or CAPC, CAPC. And they've got a tab for patients and families that has a good connection to resources. There's an organization called getpalliativecare.org that also has some links to these kinds of documents. And ultimately, it's just being aware that, as adults, we hope for the best, but we plan for the worst. And one of the best gifts that you can give your loved one is an idea of what you would want when you can't speak for yourself. Because as you and I both know, Dr. Shaw, talking to families when they don't know what to do is really painful. So being able to be responsible and talk about it up front ahead of time when it's not a problem is quite a gift for your family.
Yeah, and I think as an ICU physician who's currently practicing, I think like Dr. Mullen is saying, I think we've recognized that during this time period with COVID, family members aren't necessarily going to be in the hospital. So it's really hard to have the conversations that you would have had earlier in the same way. So I think having that those guideposts to help you make decisions is going to be super important. So I really appreciate all the information you're giving. Real quick, you mentioned a couple resources. There's other ones that we've heard about, kind of like the 5 Wishes, or the Hospice Foundation has stuff. Is there any other resources that you would recommend for people who are really looking to have this conversation and start formalizing some of these questions and answers?
Yeah, so you mentioned 5 Wishes. That is, again, something you can Google. It's a workbook. that helps patients and families have a guided conversation. And the way that it works is there are statements that if you agree with them, you circle them, and if you don't, you cross them out. And it starts with basic things like who makes decisions for you and how do you like to get information, all the way through much more personal and profound things like who do you need to forgive and who needs to know that you love them. And it can be a framework for families to know how to move through those, very tender topics. But even beyond that, I would say talk to your family doctor, talk to the medical professionals that you already have a relationship with, and tell them that you need help, figuring out how to have these conversations and how to document them.
Perfect. Dr. Mullen, thank you so much for being with us. Do you have any other advice for our members about some of not only just about COVID-19, but about any other issues related to palliative care that we would like to share?
Hold your loved ones close. This is a very scary time. And it's an opportunity as well to feel the gratitude that we have for each other.
Awesome. Thank you so much, Meg. It's been great talking to you.
My pleasure. Thank you.
Thanks again to Dr. Meg Mullen for being here with us and giving us her insights. We really appreciate her time. And to all of you, I hope you all are staying healthy and safe. And if you need any help, like getting groceries or ordering your medications, make sure you reach out to your health advisor. And also, if you just need someone to talk to, we're here for you. All right, until we see you next time, take care.